Hello, folks. We're back for another episode of Your Health Matters right here on News Radio 570 WSYR in Syracuse. Also available on 100.69 FM. Today's show is really special to me because I have a very special guest I've been following for a long time. And I know a lot of you are eagerly anticipating this episode because you are excited about this wonderful person's work as well. My guest today is Dr. Terry Wahls. She is the creator of the Wahls Protocol, is a comprehensive approach aimed at reducing the severity of symptoms and improving the quality of life for individuals with autoimmune conditions, particularly multiple sclerosis. And Dr. Wahls is also a clinical professor of medicine at the University of Iowa. Dr. Wahls, welcome
Hey, thank
and
you for
thank
having me.
you. Thank you very, very much. And so wonderful to have you here. I thought maybe we could start. Let's start with your story because I know you're living with, or
Yeah,
you were living with, the secondary multiple
progressive
sclerosis.
MS.
Yes,
Yeah.
thank you. Yes, tell
So
us about
I'm
this
an
journey. What led you to creating the Wahls
yeah.
Protocol?
So I'm an internal medicine doc. And when I'm age 45, I developed some weakness in my left leg. I ultimately see the neurologist who begins doing the workup. And when I'm going through all of those tests, I think about the fact I've had 20 years of worsening trigeminal neuralgia. I don't want to become disabled. I'm secretly praying for a fatal diagnosis. 3 weeks later, I hear relapsing remitting multiple sclerosis because I'd had a history of dim vision 13 years earlier. I have a lesion in my brain, another small lesion in my spinal cord. I do my research. I find the best MS center in the country. I see the best physician. I take the newest drugs. 3 years later, I hear tilt-recline wheelchair, in that I no longer have relapsing remitting. I have secondary progressive MS. I'm 48. My son is 11. My daughter's 8. That's what I'm asking myself. Am I doing all that I can? I decide to start reading the basic science. I go to PubMed, reading paper after paper, and decide that mitochondrial dysfunction drive disability, and I create a supplement cocktail for my mitochondria. My
Mhm.
energy is just a tiny bit better when I'm taking my supplements. I'm super grateful. And over the next 4 years, I continue to decline. By the summer of 2007, I cannot sit up. I'm in a zero gravity chair with my knees higher than my nose. That's how I staff the resident clinic. That's how I take my meals with my family. I can take a couple steps with 2 walking sticks. My trigeminal neuralgia is getting worse. I'm beginning to have brain fog. It's very clear I'm on track to become bedridden by my illness,
Mhm.
probably demented by my illness, and I'll probably have the trigeminal neuralgia turn permanently on and die with intractable pain. My boss at the VA has told me that he's reassigned me to the traumatic brain injury clinic come January, and he describes that I'll be seeing patients without residence. And I'm like, okay, I'm not going to be strong enough to do that. I'll finally have to take medical disability. 2 weeks after he tells me that, I discover a study using electrical stimulation of muscles. And this is for people who are paralyzed, who are never going to walk again.
Sure.
I'm intrigued. I make an appointment with my physical therapist and ask if I can have electrical stimulation. He says it's for athletes. He can grow bigger muscles. He's not sure my brain can talk to those bigger muscles. But he gives me a test session. It hurts really bad, but when it's over, I feel great. And so we add electrical stimulation to my exercise program, which,
And
by the
can I
way,
interrupt 1 second? Is this kind of like an electropulse therapy type of thing?
it's
Or
you put pads over the muscles, you
Mhm,
dial up the current basically
mhm,
to as much pain as you can tolerate.
mhm.
You contract the muscles voluntarily. The electricity will also contract the muscles as well. And it's very intense. Athletes have been doing this for decades to recover from injury more quickly.
Mhm.
So we add this, and I'm doing a tiny workout, a 10-minute mat workout. If I do more than that, I can't go to work.
Okay.
Then at about the same time, I discovered the Institute for Functional Medicine, and they have a course on neuroprotection. which I purchased, and it's audio synchronized PowerPoints with a big notebook of cases. And I work my way through that. I have a longer list of supplements. So now I've been doing the paleo diet for 5 years. I've been taking supplements for 4 years now, a longer list. And then I have this big aha. And Carl, I laugh at myself for how long it took to have this aha. Like, what if I redesign my paleo diet based on the list of supplements to figure out where these nutrients are in the food supply? So that's a few more months of research. And I start this new way of eating, a very structured paleo diet, December 26th of 2007. Now, at that time, I can take a few steps using my 2 walking sticks. I cannot sit up, and I haven't been able to sit up for years. I'm in a zero gravity chair with my knees higher than my nose. I'm beginning to have brain fog. I have much more severe trigeminal neuralgia. I start this new way of eating. January comes, I have to go to this new clinic. The first 2 weeks, I watch my partners examine the patients. The third week, I have to start seeing patients, on my own. So, Monday, I go in, I do my exams, write the notes. I come home and I tell my wife, Jackie, it was okay. And by the way, honey, could I sit in a regular chair for supper? So,
Beautiful.
I sit in a regular chair for supper, and it goes okay. And the next day I go back to work, and on Friday, so I've been seeing patients all week. On Friday, I come back and say, I think I can do this. And then the next week, when I'm going back to see my physical therapist, he says, Terry, I think you're stronger. Why don't you do your mat exercises twice a day? And so I'm doing 10 minutes twice a day, then 15 minutes twice a day, then 20 minutes twice a day, then half an hour twice a day. And I start walking with my walking sticks at the hospital, stunning my colleagues.
Beautiful.
And then I start walking without walking sticks, stunning them even more.
Wow.
And then on Mother's Day, I tell my family I want to try riding my bike, which I've not done in 6 years. And we used to be big bike riders. We have an emergency family meeting. My kids don't want me to bike because they don't want me to fall and lose my progress. But Jack says, let's all get in position. And she tells my 16-year-old son, who's 6'5", Zach, you jog alongside on the left. She tells my daughter, who's 13, you jog alongside on the right, and she'll follow. And I, get on my bike, and I push off, and I bike around the block. Now
Beautiful.
that big 16-year-old boy, he's crying. The 13-year-old girl, she's crying. It is remarkable. We are all just amazed what is possible.
Absolutely. I'm inspired just hearing this alone up to this point. So I have a question here. We've got about a minute before we need to go to a break. In fact, I'll ask you the question now, and you can continue this conversation when we come back. But I'd like to know how you were feeling psychologically and emotionally when you accomplished this too, because I'm only guessing that hope can take people a long ways too. Optimism, hope. You accomplished something you hadn't done in 6 years, and bingo, you had to feel great. So everybody, you're listening to Your Health Matters here on 570 WSYR. My name is Carl Sterling. Our guest today, Dr. Terry Wahls. We'll be back after this short break. And we're back continuing this conversation with Dr. Terry Wahls. So inspiring what you're sharing. I would love to learn more about how you're feeling during this whole thing. So you've gone around the block on the bike.
When you have a neurologic disorder, progressive neurologic disorder, one of the coping mechanisms is that you let go of the future. You take each day as it unfolds, no expectations of the future. So even though I had remarkably improved, I had let go of my future. I didn't know what any of this meant. When I got on that bike, what I understood is, the current understanding of secondary progressive multiple sclerosis is incomplete. And who knows how much recovery might be possible.
Mhm.
So, after that, I bike a little bit more every day, and I'm doing more electrical stimulation. And, in October, Jackie comes home and says, honey, I've signed us up for the Courage Ride. It's 18.5 miles. However far you go will be great. Now,
Mhm.
mind you, the furthest I'd gone at that point was 8 miles. But I finished it, 18.5 miles. And once again, we're all crying. My kids are crying, Jackie's crying, I'm crying.
Gotta be. Yeah.
And this really transforms how I think about disease and health. It transforms the way I practice medicine. It will transform the way I do research. And now that's the focus of the research that I do. And I've made it my mission to teach other clinicians, other physicians and medical personnel, how they can use these principles in their practice. And I've made it my mission to teach the public that, yes, even if your medical team says you have a genetic condition, or you have an autoimmune condition, or a degenerative condition, there are always things that we can do to better support ourselves through the biology of life. And often that leads to less pain, better mood, better functioning.
Absolutely. A whole bunch of thoughts going through my head right now. I work with, when I say work with, talk with, communicate with, or maybe it's research, pilot data, whatever, travel, teach, communicate with doctors all over the world. What I find is a slightly growing, let's say, population of doctors who are really forward thinking like yourself, meaning they're looking for answers that aren't in a pill necessarily. There's time and place for everything, right? Surgeries, pills, whatever. But I love these stories, and you're actually living this. You lived it. You're living with this. This is the real deal. You're a medical doctor. You're a practitioner. You're an educator. You're a researcher. You have secondary progressive MS. I mean, what better statement from an authority? Let's say I look at you as an authority figure on knowing about medicine and being able to take this to the next level outside of regular medicine and going into diet, going into things that will help reduce inflammation, that can help us to heal. So just kudos and massive respect for you for this, because you're, again, a forward thinking, a thought leader out there by example. I love this. Thank you.
It's radical to realize that by focusing on our behaviors, the modifiable lifestyle factors, we can take whatever it is that we're doing that may be disease promoting and begin shifting it to more health promoting. And we can make these changes at the pace that the patient and the whole family can make those changes.
Well, that's a big thing too, is you've now ridden the bike. You've now gone on this 18 point something mile
18.5
ride.
miles, that was very exciting.
Oh, it had to be amazing, right? The kids are crying, you're crying, everybody's crying because you're happy tears. It's so inspiring, right? And then this has a ripple effect. And so I'm getting a little into the psychology of things here, and I am not a psychiatrist or a psychologist, but what we look at now is look at the positive ripple effect it has on family, friends, loved
Mhm.
ones, maybe coworkers, and in a number of ways, right? They're hopeful, they're excited, they're happy. Um, Probably a lot of support coming from people, a lot of en- encouragement, but also a lot of inspiration from you to them. This stuff goes deep.
It's certainly, people were thrilled and amazed to see me walking around. I ended up doing grand rounds in internal medicine, talking about what I'd done and why. I started, and the person who was the chair of internal medicine, called me into his office, told me that to get a case report written up. So we did that. Then he called me back and said, I want you to do a safety and feasibility study to see if others with progressive MS could implement this complicated regimen that you did, and what happens. And so we would ultimately do that. Dr. Rothman helped me find the mentors to guide me in doing human clinical trials, which I had not done before. And I'm still working with it with those same mentors. That we are in our 8th clinical trial. We've published I'd say about 60 papers all told now on various aspects of diet, lifestyle, nutrition, multiple sclerosis. And so, when this first started, I got a lot of pushback. People were not very happy with me in the neurology community. The MS community thought my message was incredibly dangerous. But I kept going where I was invited, speaking with the groups that wanted to hear, and doing my research and publishing our papers. And more and more of our papers are being cited. We did several small little pilot studies, then a larger study comparing the low saturated fat diet to the modified paleo elimination diet, and very interesting results. Then we did an analysis looking at all of the diet studies that have been done in the study of MS. Something called a network meta-analysis that there were 12 studies comparing 8 diets, modified paleo, Mediterranean, low saturated fat, ketogenic, anti-inflammation, fasting, calorie restriction, usual diet, and a ketogenic diet. And what we saw that did those studies include fatigue or quality of life as an outcome. And what we saw is that there were 3 diets that reduced fatigue: the paleo, Mediterranean, low saturated fat. The paleo diet was about 40% more effective than Mediterranean or low saturated fat. And then for improving quality of life, there were 2 diets that improved quality of life. And that was paleo and Mediterranean, paleo being twice as effective. And when I say these diets are effective, that meant the 95% confidence interval was on the side of the intervention. So it's very, very powerful research. So I'm now being seen as a brilliant visionary.
Well, I would say you are. I say that honestly, truthfully, because see, here's the thing. If I can phrase this optimally so people understand, people weren't happy with you. They're thinking, oh, you're going off on this thing, and this might not be good. Yet you've done the homework. You're living the results of an improved lifestyle. You're no longer in this zero gravity chair with your knees up to your nose. You're walking without walking sticks. You're riding your bicycle. You're finishing an 18.5 mile thing. And who can argue with that? It also means, in my opinion, it's kind of like what I was going to say in the very beginning is if they're upset with you, you've arrived because you did something kind of like Dr. Joe Barry. I have to give kudos to him because I first heard about you through him many, many years ago. Okay, he's upstairs from me. I rent from him in this building, work with a lot of his patients, movement disorders, and all this. We have people coming in with PPMS, and lots of different things. So he told me about you, and he is one of those people the medical world is relatively upset with. It's because his people aren't nearly as sick as all the rest of the people because he's a thought leader. So, anyways, folks, we have to head out to a news break here. We are with Dr. Terry Wahls. It's an amazing conversation. We'll continue in just a few minutes after this news break. This is 570 WSYR. My name is Carl Sterling. This is Your Health Matters. See you in a few minutes. All right, and we're back. We're back with Dr. Terry Wahls. We're talking about her story, living with secondary progressive multiple sclerosis, and what an amazing journey, inspiring journey. So, Dr. Wahls, I'm curious to know, first of all, what is secondary progressive multiple sclerosis? How does it differ from
Sure.
PPMS and the other couple? And then I'd love to know, how are you feeling now, this many years later? How is life treating you right now?
Well, I'll answer that one. That's pretty fun. So this morning's workout was a jog. So I jogged for 20 minutes on my treadmill. Then I went up and did a sauna, a near infrared sauna for 40 minutes. I took a cold shower. I am great.
Good.
And so let's sort of review what is multiple sclerosis, the various types. Multiple sclerosis is a autoimmune condition that leads to damage to the brain, cranial nerves, spinal cord, that's through the immune cells. When you have an acute episode, that's called a relapse, there is an enhancing lesion on an MRI. If you and that happens when you're young, under the age of 40. When you and 80% of people are diagnosed with relapsing remitting MS. So you have acute episodes of relapse, you get a little bit better. That's called a remission. There are some individuals, about 10%, who never have an acute relapse, who just have the slow progressive decline. That's called primary progressive MS. And then the vast majority of people with relapsing remitting MS, sometime between the age of 45 and 55, stop having relapses and have only the progression, that is shrinking brains, shrinking spinal cord. That's called secondary progressive MS. So I converted to secondary progressive at the time that you would expect at age 48. I probably, in retrospect, had 2 relapses the entire life. The first time when I had the episode of dim vision, and the second time when I had the weakness in my left leg. Otherwise, it really was more this progressive, slow progressive decline.
Okay, I appreciate that very much. I have a quick question here. In the PPM, people with PPMS I've seen, what I notice is, and I don't know if this is common, but it seems that the legs are affected more than any other part of the body. And I wonder if that has to do with the spinal sheath
Well,
unraveling or whatever. And how about
um,
secondary? What's happening in the spine? Is there usually a certain place in the spine where
so
you're having
what
anything?
tends to happen is if the legs are affected, that is a visible symptom,
Hmm.
and it's very visible that walking has become a problem.
Yeah,
A majority of people will develop problems with anxiety, depression, fatigue. That is not as visible, and they may have difficulty with brain fog. And those are the reasons people have to leave the workforce, is because of brain fog, anxiety, depression, fatigue. Uh, uh, Many people over time will eventually have difficulty speaking, difficulty swallowing and controlling swallowing, so they're more likely to cough, aspirate, and have pneumonias. But because walking problems are so visible, that is certainly apparent for people with progressive MS. And the longer you have MS, the more likely it is that you're going to be having gait or walking impairment.
sure, sure. I've noticed in particular 2 cases, especially where the tibialis anterior is a little bit on slack. It doesn't want to do its job. Dorsiflexion becomes a challenge. Sometimes both legs, sometimes one leg. This is just what I've been seeing, um, which is limited compared to what's out there. Um, but you know that electro pulse, we call it electro pulse here, which is sort of like a TENS unit, except it's not a TENS unit. What we're using, it helps to fire up those muscles. It's
It
beautiful
is
for
very helpful. It
stimulation.
helps restore
Yeah.
that connection between the brain, down the spinal cord, out the motor nerve. If you do that along with voluntary contraction of the muscles, it
Hmm.
can be very, very helpful.
Well, I appreciate you sharing that. That just helps me to sort of reinforce what I've been doing based on what I've been reading, which is a lot of your work. Um, so moving forward, you're feeling good now. You mentioned the cold shower, cold therapy and heat therapy, the polar opposites. It seem to be very popular right now, and seem to be, especially the cold, highly
Yeah.
beneficial for many reasons. And are you finding that that's helping you?
Yeah, cold therapy is really great. I love ice baths. I love swimming in cold water. I used to take an ice bath every night before going to bed. And then my wife said, honey, I don't like those cold legs. Would you do your cold shower in the morning? Because I'd rather snuggle with warm legs. So, in the interest of domestic harmony, I rarely do an ice bath in the evening. I'll do more cold showers in the morning.
Okay. I love how you put that. That was beautiful. Okay. let's talk about this because radio minutes go so quickly. All right. About 4 more minutes, we have to take a break. Then we have another 9 minutes or so. I want to dig into the meat and potatoes here. Besides, before the end of the show, telling people where to find your book, which of course I'm sure we can find it all over the place and Amazon and everywhere. But what if we begin a takeaway message or suggestions? What should we do as humanity? First of all, what should we doing to take care of ourselves? How should we eat? And if you're into having a movement disorder, neurological issues, MS, PPMS, secondary, whatever, I'm sure a lot of that protocol just it all applies to all of us. We're all humans. What do
You
you
know,
advise us to do?
so I want to acknowledge that it's hard to change habits.
Yeah.
And so knowing why you want to do this, what you do if your health could moderately improve, have a negotiation with your family where the foods you're going to increase, where the foods you're going to decrease as a family will be very helpful. So I'll start with the ads: more non-starchy vegetables, sufficient protein, so 6 to 12 ounces of meat, non-starchy vegetables, a lot of greens, cabbage family, onion family, mushroom family vegetables, and things that are deeply colored. Then the things to remove. We know the more added sugar, the more ultra processed foods, and those are flour-based products, breads, cereals, pastas, the worse the health outcomes. So reduce those. I specifically want you to take out gluten-containing grains, dairy products, and eggs because they often cause an abnormal immune response.
Okay.
That's a great start.
Okay. Gluten, dairy, eggs. Very good. Yeah, I wrote it down, even though I can listen to this now forever, but still, it's just prompting more and more thoughts in my head. So it appears to me then, not to be presumptuous, we're going to decrease our inflammation this way, and inflammation causes so many problems. It seems could be
Well,
maybe even the root cause of many diseases.
we need inflammation to maintain and prepare ourselves. So you have to have the correct amount of inflammation.
Mhm.
And you want to be able to repair, but not over attack.
Okay. And it's interesting. I've never heard of that before until correct amount of inflammation. How do we determine that? Is there a way?
Well, if you skin your knee, you need inflammation to repair the damage, and then it needs to stop when you finish the healing process. If we have altered our cells so we can't recognize them as normal, we may begin to attack them, and that leads to the abnormal, excessive, ongoing inflammation.
Okay. All right. Very interesting. When we come back, we will continue with Dr. Terry Wahls here on Your Health Matters News Radio 570 WSYR. And again, it is available on 106.9 FM and, of course, live streaming too. You can Google that or go to my website, carlsterling.com, KARL sterling.com, where you can live stream the show, and you'll be able to hear this show forever on the recorded episodes there on the radio show page. Heading out for the last break, and we'll come back and do some more talking about the Wahls Protocol. Thanks for listening. And we're back for the last segment of the show here. Appreciate everybody listening. Well, I've been having a blast today. Thank you, Dr. Wahls.
Hey, thank you.
This is really, really great to meet you. I've been looking forward to this so much. And you're enlightening us with so much great information. Tell us in this last few minutes, let's talk to those people out there who are ready to make a change. What do you have to say to them? What's your takeaway
So
message?
think about why you want to make the change. Talk to your family, negotiate what are the things you're going to add into your self-care routine, and do it as a family. You'll be much more successful. And if you want to have a resource that will tell you all of the many different things that you could consider, pick up the Wahls Protocol. If you're looking for a resource on how to begin preparing the food, pick up the Wahls Protocol Cooking for Life. And if you got my first book when it came out in 2014, pick up the newer version that I updated in 2020. that has about a third new content, updated research that is so valuable. So be sure to pick up the one that has the blue bar across the top, revised and expanded. I want everyone to follow me on Instagram, Dr. Terry Wahls,
Please.
so you can see what I'm eating and doing. You'll get a lot of tips in terms of what you can do for your self-care routine.
I'm
And
going to interject. You do have a really, really good Instagram page.
it is fun.
Great information. Yeah.
And it's plus you get to see me cheer on the Iowa women's basketball team because I follow them around. You see what I'm doing in life. So it's a glimpse into my personal life, and it's a glimpse into my research life. We talk about our research, and we have a bunch of information messages as well. And with that, and for everyone who's listening, I want you to go to terrywalls.com/MS study and sign up to be part of our patient registry because we do clinical research. We have a bunch of survey-only based studies, some virtual studies, and we have a study comparing a ketogenic diet, paleo diet, and usual diet for those with relapsing remitting multiple sclerosis. I want all of the listeners to sign up to be part of our patient registry because we do a bunch of different diseases. We're studying fibromyalgia, long COVID, cancer-related fatigue, and people who've been treated with cancer. And then, of course, the study that we're doing in the MS patients comparing a ketogenic diet, paleo diet to usual diet. Because if we're going to change the standard of care, Carl, I need to do clinical trials that show a difference. And so if you're already on a therapeutic diet and you have relapse remitting MS, that's okay. The key thing is you have to be willing to be randomized. And if you're randomized to either the keto diet or the paleo diet, you'll like, okay, that's the diet I'll follow. If you're randomized to the usual diet, you get to keep doing your usual diet. We'll give tips to the usual diet folks every month on things they can do to improve their diet. We'll give more precise education on the keto diet to the keto group and more precise education on the paleo diet to the paleo group. This is one of the largest, longest dietary intervention studies that will have been done in the setting of multiple sclerosis. And you know, my team tells me that we have room for 20 more slots. And Carl, I would love to have folks from your radio tribe be part of those 20.
We have a large listener base, and we know there are quite a few out there, unfortunately, with living with MS in some form or other. And so,
Since
that's the other
having
thing too, is there's never been enough funding for especially MS
correct.
because it's just there aren't enough people with it. Yet there are a lot of people with it. So these studies are so important, folks. They're so important. So can you say your website again for us?
So Terry, Terry, Wahls, WAHLS.com /MS study.
Beautiful. And also follow her on Instagram, which is the, @ Dr. That's DrTerrywahls. I'm going to have links to all these things on my website so they go right to your site, folks, in case you don't remember it or, you didn't get a chance to write it down or you're driving right now or whatever. We have like 4 minutes left. Let's keep talking.
Yeah, let's keep talking.
Let's keep talking.
I want everyone to know that every week we get contacted by individuals and families that are so grateful that they discovered my work. Often I have to look up the disease that they're talking about. Sometimes it's a genetic disorder, and they'll tell me that their physician finally said, there's nothing more that we can do. Somehow they stumbled on my work, began implementing the concepts that they learned about in the Wahls Protocol, and the quality of life for their child or for the person as adult remarkably improved. Now they still have their genetic disorder, they still have some limitations, but the person's doing better. And it makes sense to me that if we improve the nutrition, improve the sleep, improve the exercise, improve all of those modifiable lifestyle factors, it makes it easier for the cells to do the biology of life more correctly.
Mm-hmm.
So, whatever your health condition is, I encourage you to begin to work to improve your health behaviors, improve your nutrition, pay attention to your sleep, pay attention to your social connectedness to others, begin moving. And I predict your fatigue will be a little less, your mood will be a little bit better, your mental clarity will improve, your spouse will be much less annoying, your coworkers will be much less annoying, your children will even be less annoying. And pretty soon you realize, I think I'm happier. And that's what we see in our clinical trials. That's what we see in my clinical practice. That's what I see in my inbox from the thousands of grateful people who contact us time and time again.
Well, I can't think of any greater words of wisdom, Dr. Wahls. And I love also that you, because you're doing this by example, though, too. But you mentioned to start to move a little. And I think as a movement specialist in my work and a bunch of other stuff we do too, but therein lies potentially a lot of problems because, or many problems because of the lack of movement. So,
Mhm.
folks, like Dr. Terry says, and I say every week, got to get moving. One thing I find is if you get moving, you get started. Generally speaking, you'll probably get the energy to keep going more than you think you will. And I can guarantee
Mhm.
one thing, almost all the time, you will feel better when you're done. Happens to me almost every time. And you know me, audience, you know me. I admit, I never really feel like working out. I'd rather do the couch fit workout than the CrossFit one. And once in a while I slip and I do the couch fit. But I do the CrossFit a lot more. And it's my daughter. You know, we love doing that together. And it's great time together. Biking, running, lifting, whatever it is, get moving. Um, I can't believe we're at the end of the hour here. I just want to say thank you, Dr. Wells. Thank you again from the bottom of my heart. We love you. We absolutely love you and your work, and I appreciate you so much.
Thank you, Carl. And I love what you are doing as well.
Thank you, and you know, of course, we will be on the lookout for any new information coming out. I appreciate your time so much. That's the other thing I want to say thank you because I know you're really busy. Because we've overall been communicating for quite a while with your team, by the way. You have a
Oh,
beautiful
good.
team there. Well, this team is
I have a
fantastic.
great team.
They're on your side, they're in your corner, they're doing great things for you. All right, Dr. Wells, thank you again. Thank you, everybody, for listening. We'll be back next week with another episode of Your Health Matters. You're listening to 570 WSYR News Radio, also available on 106.9 FM. Thanks again, folks, and have a fantastic week.